Let me ask you, have you ever met just a nurse? Have you ever heard someone say, "I'm just the nurse"? Well, I've been just the nurse for 38 years. I'm here to tell you there is nothing just about it. I'm the oldest of 5 children in a very traditional family, which is to say, I was the first to think of going off to college. So one day, my dad and I were having a serious conversation about what career I envisioned for myself and what future I thought I might have. You see, I had it narrowed down to law school or business school. Well, when I finished, he listened and looked at me and said, "Unfortunately, Debbie, that's not the way the world works for girls. You should be a teacher or a nurse. You can't have a successful career in either of those fields that you've chosen. But as a teacher or a nurse, you can take time off for a family and still have a successful career." Well, I have to tell you, when he said that, I thought, I can't be a teacher. And I had this vision of nursing in my mind. And so I'll tell you, I was more than a little angry. I thought, but I don't want to be just a nurse. What I wanted was a successful, fulfilling career that left me feeling empowered to make an impact on others. I didn't want just a job dealing with bedpans and bed baths all day, working shifts and doing what I was told, taking orders. You know, at that time, there just weren't many images of empowered nurses in the 1980s. I can tell you, standing here today, I surely didn't have any of these images in my mind. A trauma nurse, a flight nurse, a perioperative nurse, or a critical care nurse. But more important than these images, I have to tell you, I could not have imagined what it was like to build a relationship with the patient and that lasting bi-directional impact that the patient has on the nurse and the nurse has on the patient. You see, as humans caring for humans, it's always a two-way street. Well, I chose nursing, and I can tell you, I feel so fortunate to have tripped into this amazing profession. I recall my first shift as a clinical nurse, straight out of orientation with my own assignment. I was working on a medical floor in Cleveland, Ohio, and as I got report from the nurse as she was leaving, I couldn't help but think to myself, they're entrusting me with the care of these sick people? These patients are looking to me for care, information, and reassurance. I'm not ready. Well, I'm happy to say I made it through the shift, and I didn't hurt anybody. My bar was pretty low. It was also the first of many days that I felt overwhelmed at the enormity of the responsibility of being a nurse. But fortunately, I quickly learned patient care is a team sport. Now, don't get me wrong, bedside nursing isn't all glamorous. In fact, some parts of nursing were exactly what my high school self feared they might be. I recall the night shift I was helping a colleague clean and change an incontinent, extremely confused, bed-bound elderly patient. We log-rolled the patient towards my colleague. I cleaned him and took the fresh sheets, rolled them, tucked them under him, and we were going to roll him back towards me so she could repeat the process on her side. Except that when we log-rolled him towards me, I suddenly felt warm liquid running all down the front of my clean white uniform. I didn't feel so lucky to be a nurse in that moment. But then there are other stories. Working on that same medical floor in Cleveland, Ohio, there was a gentleman who was admitted multiple times, his wife by his side through it all. Each time he was admitted, he'd be with us for 4 or 5 days with a fever of unknown origin. He would go for diagnostic testing, and then we would talk about what it was like to live with these reoccurring symptoms and yet no definitive diagnosis. We would give him IV antibiotics, pump him up with fluids, and send him home, only to have him return a couple weeks later. Because of his multiple readmissions, I had formed a relationship with both him and his wife, a relationship that I consider to be sacred, the nurse-patient relationship. That's a therapeutic relationship built on trust, respect, and empathy, in which I, as the nurse, use my knowledge and skills to support the patient's physical, emotional, and spiritual needs. When he was admitted, each day I would walk into his room and I would be greeted with, "Oh, Debbie, you're here. I'm so glad you're our nurse." I could feel their sense of relief at seeing a trusted and familiar face. And I'll tell you, for me, with that greeting, I felt such joy and fulfillment. It's hard to describe even to this day. One day I came in and I saw that he was readmitted, and so I entered his room. But this time, my greeting was completely different. As soon as they both saw me, they burst into tears, and he said, "Debbie, did you hear? I have cancer." Well, I hadn't heard. I assumed he was back with his fever again. But my response when I heard that, "Finally, we know what we're treating. Now let's get to it." And so I sat down with the two of them so that we could talk about their fears and concerns. As we talked, they began to feel a little hopeful and see a potential path forward. Unfortunately, I wish I could tell you otherwise, but in the end, there was no happy ending. But what I can tell you is that while he was with me and on my unit, he felt cared for and supported. You see, this was that sacred nurse-patient relationship in action. I began to realize that through these relationships and interactions, I did have the ability to make an impact on others in ways that I never could have imagined. And so some days at the end of my shift, I would walk to my car and think, they can't pay me enough to do that. But most days, at the end, I would walk to my car and think, I can't believe I get to do this. I can change people's lives. Through my interactions, I had both the privilege and the opportunity to become a part of every patient's story forever. The American Nurses Association defines nursing as integrating the art and science of caring, focusing on the promotion, protection, and optimization of health and human functioning, the prevention of illness and injury, the facilitation of healing, and the alleviation of suffering through compassionate presence. Nursing is the diagnosis and treatment of human responses, and the advocacy in the care of individuals, families, groups, communities, and populations, all in the recognition of the connection of all of humanity. Anyone that does all of that isn't just anything. Anyone that does all of that is an empowered professional who, through their compassionate presence, the art of nursing, and their knowledge and skills, the science of nursing, has the ability to change the world one patient interaction at a time. So let me ask you, can you see cleaning an incontinent elderly patient as a means of alleviating suffering and preventing injury? Or do you see it simply as being urinated on? When you hear a nurse say, "I think we ought to," do you hear advocacy in the care of an individual or family? Or do you hear a complaint or an affront to your judgment? How we as nurses perceive and understand our role in patient care is vital to our ongoing fulfillment and professional identity. Today, there's a national and global nursing shortage. Worldwide, that shortage is estimated to grow to 4.8 million by the year 2030. Think of that number in the context to access to quality care. Put simply, not enough nurses results in limited access and poor patient outcomes. Now, the reasons for the shortage are many and surely complex, and there's no one single answer. But I can tell you, in my role now leading almost 10,000 nurses, attracting and retaining the best and the brightest who passionately pursue our profession must be a cornerstone of our solution. One day we'll all be a patient, and so it's in all of our best interest to ensure that nurses understand the unique value that they bring to patient care and that they feel a sense of empowerment to impact others, just as I'd hoped for so long ago. We can't afford to allow nurses to think of themselves as just anything. Our healthcare system, we need professionals to join us who can recognize and respond to human needs, who can integrate science and compassionate care, and who can proudly say, "I am a nurse."